Health and Safety Committee meeting. We will take some of these resolutions on a consent calendar here, consent agenda. If you want anything pulled, please let me know. So we will begin with RS 2023-2331, Roten and Syracuse, appropriates $12,000 from a certain account of the Community Safety Fund for a grant to API Middle Tennessee for South Nashville Community Safety Programs. RS 2023-2332, Roten, Syracuse, Hurt, and Welsh appropriates $32,293 from a certain account for the Community Safety Fund for a grant to ASMT, Inc. for South Nashville Community Safety Programs. RS 2023-2333, Roten, Syracuse, Hurt, and Welsh appropriates $48,000 from a certain account of the Community Safety Fund for a grant to Black Mental Health Village for South Nashville Community Safety Programs. RS 2023-2334, Roten and Syracuse, approves an application for a community-based violence intervention and prevention initiative grant from the U.S. Department of Justice to the Mayor's Office of Community Safety to implement programs aimed at mitigating community violence and establishing a community violence intervention and prevention initiative to reduce violence in Nashville. RS 2023-2335, Roten, Syracuse, Hancock, and others, approves a grant from the Tennessee Department of Transportation to the Davidson County Sheriff's Office to provide litter pickup and litter prevention education within Davidson County. RS 2023-2343, Roten, Syracuse, and Hancock, approves an application for the statewide School Resource Officer Program grant from the Tennessee Department of Safety and Homeland Security for the placement of school resource officers in schools for the continued efforts to establish and maintain safe and secure learning environments. That is the consent agenda. Hang on a second, because I missed a step. The public comment period pursuant to Tennessee Public Chapter number 300. Time is reserved for public comment on legislative items appearing before this committee. I have confirmed that there are none, but we do have some on the joint committee that is coming up at 4 o'clock. So we've taken care of that procedural step. Okay, back to the consent agenda. Do any of those items need to come off? Seeing none. All in favor of the consent agenda? No? Any against? You recommend approval of the consent agenda. Hang on a second, I'm checking. Foley, Roberts, Rosenberg, Swope, Taylor, and Virtue. 1, 2, 3, 4, 5, 6, 7. Yes, I have a quorum, of course. All right, so consent agenda passes. You recommend approval. Thank you very much. 7 in favor, 0 against. Thank you. All right. So back to Resolution RS 2023-2295, Roten, Syracuse, and Hurt. Approves a grant contract between the Metropolitan Government Board of Health and Why We Can't Wait, Inc. for the provision of violence interruption services. Can I get a motion? All right. Second. Properly seconded. All right, so we do have a proposed substitute from Councilmember Toombs, and then a letter to defer from Councilmember Toombs that Councilmember Gamble is going to handle. Before we entertain the substitute, though, I did want to allow our juvenile court representative here. Jennifer, are you here? There you are. Yes, come on up. Juvenile court can't be here in 2 weeks, so I've offered the opportunity to speak about this before we move forward and have any other discussions. So I believe your mic should be working now. Maybe? No. Public table. Okay.
Hello. There we go.
Thank you so much. Appreciate you being here.
Thank you.
We welcome your thoughts.
Thank you for having us here. I'm here today in large part just to answer any questions that any of the council may have that directly impact juvenile court. Of course, we support this bill to get violence interruption program into our city. We know that Cure Violence is a trusted model that we seek to engage with and support the work that's being done and support the recommendations that are before the council.
Okay. Well, thank you very much. Thank you. I guess we can entertain the substitute now. So I will go over to, I got this, Councilmember Gamble. The floor is yours.
Thank you, Chair. The substitute
you want to move it?
Yes, move the substitute.
The second,
Well, you know what? We didn't move the substitute in
budget and finance?
budget. And so what I would like to do is.
So we have a,
But if we can take a few more questions before
sure.
we move for that.
absolutely. So before then, we entertain, well, I guess we're not going to entertain the substitute unless somebody else wants to move that. But I wanted to offer an opportunity for health or PD to also come up and give us your thoughts on where we are on this initiative with Why We Can't Wait and where we're headed collectively on this effort.
Yeah, good afternoon.
Mr. Johnson, thank you.
The health department has fully supports the original resolution. I think we've sent some comments to this committee regarding our support of the original resolution as written and as it pertains to the organization that's identified there. So,
Okay, thank you. We understood. Yes, sir. Chief?
Good afternoon, Dwayne Green, Assistant Chief of Police. The police department, of course, signed the MOU for a while. We can't wait, and we support the original resolution that has been submitted.
All right, thank you. Yes, Councilmember Gamble, floor is yours.
Thank you, and thank you, Chief Green and Anthony, for being here today to answer questions about this. As you may know, Councilmember Toombs has submitted a letter to defer this or vote no on this resolution as is because it excludes one of the organizations that was also recommended by the Community Safety Fund Advisory Committee to also engage with Metro in these violence interruption using that cure violence model. Can one of you speak to why Gideon's Army, the other organization that was recommended by the committee after reviewing several applications from organizations interested in doing this work, the committee back in 2002, I believe it was, recommended those two organizations. Can you explain why that one is not included?
well, our task was to create a democratic process, and what we are, I guess, settled on was the best practices in terms of implementing the cure violence model with fidelity. And after reviewing all the information and things of that nature, Why We Can't Wait was approved through Metro's grant writing process.
Approved by whom? I'm not sure. I don't follow because the committee, which I was serving on at the time, approved both organizations through that grant process. So after that, are you saying that there was another approval process that happened that excluded the organization that the committee approved?
Well, it's my understanding of the process, or our understanding of the process, that the recommendation from that advisory board was just that, a recommendation. And from that, there were other efforts taken to determine whether a proper contract between the entities could be created or entered into. And based upon that extra work, we landed where we landed.
And who was involved in that extra work, if you don't mind?
Members of the health department, some members from the mayor's office, I think members from Metro Nashville Police Department, members from Metro Finance, members from Metro Legal, I think some internal finance at the health department. I think when you look at the application, there are a set of requirements that are in there. When you look at the contract, they're the same. When we reviewed everything, our language, the language that's both in the contract, that's both in the application, is consistent with other cities who've explored using the cure violence model. Those cities include Grand Rapids, Michigan, Savannah, Georgia. I'm missing another place, but yeah.
Thank you. I guess you're also aware that Gideon's Army, the other organization that was recommended by the advisory board, has also been engaged in the cure violence work and has been trained on the cure violence model in Chicago and has been doing that work for several years. So that's the reason why I'm wondering what were the other conditions or what were the other tests that made this secondary committee decide that they were not eligible or shouldn't be included?
Well, those requirements are pretty specific, even in the application and the contract. And when you start looking at the conditions for implementing the model with fidelity, I think that's where some of this tension, or I think the answer to your question really lies. I'm not trying to get into full specifics there. I don't really like pitting one organization against another. That wasn't the intention or the focus of the work that was done. I think it's been double, triple checked by now. I know the police department has position here. I think all of those dynamics are part of this. There was no effort to exclude because of the complexity and nature and even the relevancy of the work that needs to be done. I think here we have a situation where one organization has gone through the entire process, and I think it's in Nashville's best interest to move forward with that organization to do this work that's very vital to the city.
Okay, and I'm not sure what you mean by one organization has gone through the entire process, but if Mr. Johnson, Ron Johnson, could speak to how the process that happened after the advisory board recommended those two organizations, because both organizations went through the same process for the evaluation, the submittal of a request for proposal, the evaluation, the scoring, the interviews. Both organizations went through everything the same. I served on the committee and worked with them on that. So I'm just wondering if you can explain, because I'm not sure that I'm getting that answer, what happened after that the one organization was excluded or didn't meet the requirement?
So the requirements were when we put out a grant application for the city for organizations to apply for the cure violence program that we were looking to implement. There was a number of organizations applied, and applying we had a list of number 1 all the way down to I think we had 6 or 7. And in that list, a number of those organizations who scored pretty high decided to drop out. And as we went down the list, the two groups that was chosen, which was Gideon's Army and Why We Can't Wait, they were not the top two groups originally. But what had happened after that, because you do the cure violence model through the health department, it is a health issue. As we know it, violence is a health issue, and that's the way it was being addressed. And the health department was assigned to provide the contracts that will take place between the groups that would be doing the program for violence interruptions. Now, as far as the mayor's office and the advisory board, what we had done was our role was to find the groups, get them approved, send it to the entities, but it's the entities to implement it, but it doesn't make us, we don't get to make them do it. We get to get it to them, and then they have to put the application forward. And in doing so, what they came up with was one group met the qualifications and the other didn't. Now, we didn't go through that as far as qualifying them. They were qualified as far as we're concerned, but the difference was when it comes to signing a contract, that was a different element. Now, the mayor's office did not have anything to do with creating a contract, but there are some best practices that we were been told. We've been working and talking with the health department. We've been working and talking with members of councils from time to time. But the point of that is the health department is the entity that will put forward the contract that will take place between the organizations.
Thank you. That answers my question. So it seems like the entities that will be implementing the program made the decision to exclude that one organization. So thank you. Thank you for that.
Thank you, Councilmember. Councilmember Evans will be next, but before I give it to Councilmember Evans, because we do have an upcoming deferral motion here, my request from leadership of PD and Health, for those that have not been involved in the advisory council and may not understand fully the cure violence model and what the contract for that to implement it correctly. If you could perhaps give us some sort of synopsis before the next meeting so that council members can have an understanding and follow your thought process as to why Gideon's Army does not qualify for that contract. I think that would be very helpful for all of us. Okay. Councilmember Evans, floor is yours.
Thank you, Chair. I just wanted to understand, maybe from the administration or maybe from Mr. Johnston or anybody else, if there's any intention of using Why We Can't Wait as the primary contractor and Gideon's Army as a subcontractor in this situation.
Mr. Johnson.
Yes. Our intent is to follow the requirements as stated in the contract. So we support the original amendment that focuses on why we can't wait. There has not been any discussion or consideration to view this as a primary or subcontractor type situation.
Thank you.
Thank you. Any other comments, questions from council members? Councilmember Swope, floor is yours.
Yeah, thank you, Chair. Since I'm completely unfamiliar with Why We Can't Wait, I've just Googled it. And the most recent thing on Why We Can't Wait is in 2016. I don't know, that was 7 years ago. The question is has Why We Can't Wait done anything in this city since 2016?
Absolutely. They're in the process of wrapping up some of their programs for this summer, I think today or this week and things of that nature. As far as their website presence and things of that nature, I have no control over that.
Okay, and maybe you can't address this one, and please take no offense to this question, but on your own website from 2016, your financials from 2016 are $23,067.
Yes, I'm not a member of Why We Can't Wait and not an expert in their financials. What I would say is that they were vetted, if that's the proper word, by Metro Finance and things of that determination. They're a wonderful organization. I'm purposefully trying not to butcher what they do and what they've accomplished. I think they've answered some questions on behalf of a council person in terms of, I think from that statement, I remember they have over 70 years of experience as an organization working in this space and serving Nashville in a very positive, effective manner.
I appreciate that answer, and I'm sorry, I thought you were with Why We Can't Wait, so forgive me if I ask you questions that were inappropriate. And just for clarity, their own website says they were founded in 2014, not 70 years ago. Can finance, anybody from finance, is there anybody here to address that question? I'm in complete support of a deferral on this.
We can certainly
Thank you.
get that answer. Thank you, Councilmember Swope. Councilmember Porterfield.
Thank you so much, Chair. I did have a question around Why We Can't Wait. Has Why We Can't Wait done any violence interruption in Nashville currently?
They would characterize their work as violence interruption, yes. They've worked with people returning from incarceration. They work with young people and things of that nature. As Mr. Johnson, the other Mr. Johnson, indicated, they gave a presentation to that Community Safety Advisory Board, and they were one of the organizations ranked there for this work. As far as specific experience implementing the Cure Violence model, again, I don't want to talk for anyone. They will tell you they don't have experience specifically with that model. However, they have other experience with other violence interruption models, activities, frameworks, and things of that nature.
Thank you. So for clarity, the council is moving forward with working with Cure Violence. Gideon's Army has experience working with Cure Violence, but the recommendation is to go with Why We Can't Wait, an organization that does not have violence interruption experience with Cure Violence. Is that what I'm understanding?
I think the way you're characterizing it is leaving a lot of work.
It's a yes or no, respectfully.
Yeah, it's more complicated than that, in all due respect. So I think it's not just clear cut. I think we have organizations in this city who say they do violence or interruption, and we have a best practice model that this democratic process was designed from.
Thank you. Can you answer yes or no for the question that I asked, though?
I'm not sure as to...
The council is going forward with working with Cure Violence. Is that correct?
No.
We're not working with Cure Violence?
We're implementing a Cure Violence model.
Okay. Has Why We Can't Wait worked with Cure Violence?
Technically, no.
Okay. Has Gideon's Army worked with Cure Violence?
I am not fully familiar with all of Gideon's Army's experience with Cure Violence. My understanding, they may have received some training from them, but I'm not an expert on Gideon's Army, nor Why We Can't Wait.
Thank you. I think it's public knowledge that Gideon's Army has been working with Cure Violence. I also support a deferral of this, Chair. Thank you.
All right. Any other comments, questions? Councilmember Gamble, back to you. Floor is yours.
There are no other comments. I move for a deferral.
All right. So we have a motion, second on a deferral. Councilmember Pulley, floor is yours on the deferral.
No, just simply a clarification. Is it a deferral for one meeting? Is that what we're moving?
Very good.
Okay.
Yes, it was a meeting for one, deferral for one meeting. That's all we got. All right. Absolutely.
Yeah, there is
All
only
right.
one meeting left, isn't there?
Any other discussion on the deferral? All right. All in favor of a one meeting deferral? Huh? Any against? Abstentions? All right. So you recommend one meeting deferral. Thank you very much. We are at 10. Let's see. Okay. All right. Who else we got that came in? Rosenberg. Yes. Gotcha. In Porterfield. Yeah, got it. Okay. On to bills on second reading. BL 2023-2106, Syracuse O'Connell, Pulley, and others, amends Metropolitan Code to clarify that all types of amplified music, including live music, must be limited to certain decibels to ensure adequate public health and safety. I have a proposed substitute, so I will go ahead and move the proposed substitute. Got a second? If it's okay, I'll start the discussion. Is that all right? Anybody else want to speak first on this? But I can certainly give you a lot of information on this. Okay. Okay. So the title of this, because of the substitute, is actually a little bit inaccurate, if you will. I agreed to take this on as chair of Public Health and Safety, but one of my first messages to all the businesses on Lower Broadway and the musicians and hospitality workers was that I would do my best to try to bring a general consensus to this issue. And if we could not find one, then I would kill this. But at least that we would start a robust and a good conversation. I'm pleased that my proposed substitute here does bring this consensus. It limits this to a very specific issue, which is level setting, pun intended, with interior speakers, not exterior speakers. It just says that interior speakers, which are generally the louder ones next to musicians, 10 feet away from the window, can't be oriented outside. That's it. And then what it does is it puts an advisory committee together, led by our director of the Mayor's Office of Nightlife, to put a committee together to start looking at some of the nuances and specifics. But what I've zeroed this down to is just level setting this issue to just that. The other piece that it does do is it gives NDOT and codes some enforcement capability. And then an MOU is actually going to be put in place between PD, codes, and NDOT so that they have a clear understanding of the enforcement and who's the expectations of who is supposed to be handling what. So I'm pleased that between musicians, the Broadway businesses, we do have consensus on this. And so this does set this up so that the next council, working with Mayor's Office of Nightlife, can work with the Broadway business owners and start to look at some nuances and see if anything comes out of that for further efforts to help ensure, obviously, safety, health of musicians and whatnot, but also something that is pragmatic and not going to hurt a healthy businesses down on Broadway. So any other questions on the substitute? I'll entertain. Yes, sir. Councilmember Swope.
Thank you, Mr. Chair. This does impose decibel levels.
It does not change the existing decibels in the current code, which is 85.
Oh, really?
And it leaves in the live music exemption that already exists.
Okay. Thank you for that clarification.
Sure. Thank you. Anybody else? All right. All in favor of the substitute? Against? Abstentions? All right, so you adopt the substitute. So then I will motion to move as substituted. Have a second. Any other discussions on the bill as substituted? All right, all in favor say aye. Against? Abstentions? You adopt. Thank you, everyone. I appreciate it.
Yes.
That is an abstention. You got it. 9 in favor, 0 against, 1 abstention. All right, on to BL 2023-2110. Welsh, Roten, Syracuse, and Porterfield approves a limited revocable license agreement between the Metropolitan Board of Health and the Kosheka Community Development to create, operate, and maintain a non-commercial community garden on the west side of the Woodbine Clinic to utilize Metro property to improve community health and nutrition. Apologies if I butchered the name. Can I get a motion? All right, properly seconded. Any other discussions, questions on this? Sounds like a great initiative. All in favor? Against? Abstentions? You recommend approval. 10 in favor, 0 against. Thank you. And finally, BL 2023-2125, Councilmember Murphy amends chapters 10.16, 10.40, 10.44, and 10.72 of the Metropolitan Code to include provider-neutral language. Can I get a motion? Properly seconded. Questions, comments? None. Seeing none. All in favor? Any against? Abstentions? 1 abstention. All right. So you recommend approval. 9 in favor, 0 against, 1 abstention. Thank you, everyone. That concludes the standard Public Health and Safety Committee meeting. Stand by for our joint safety meeting in 1 minute. Thank you.